non-profit organization, Global Alliance relies on the efforts of communication professionals to tackle common problems with a global perspective.
Global Alliance's mission is to unify the public relations profession, raise professional standards all over the world, share knowledge for the benefit of its members, and be the global voice for public relations in the public interest.
By partnering with regional, national, and international bodies to increase professionalism in public relations and communication management, this alliance works to enhance the collaborative competence of the industry among its constituents around the world.
Global Alliance is at the forefront of the representation of PR and communication management as a profession in which the importance of ethical behavior is unquestionable. The development of a global protocol on ethics for public relations and the requirement that all Global Alliance members ratify it demonstrates this commitment to integrity.
The Global Alliance's vision is to enhance the role and value of public relations and communication management to organizations and to global society.
Joining Global Alliance gives you the opportunity to engage with the world's communication professionals and benefit from special discounts from member conferences around the world.
The World Public Relations Forum,
regional conferences,
association leaders workshops,
networking with world members,
participation in our self-assessment global capabilities framework.
Expand your knowledge with the PRSA learning platform and keep up to date on world and insights with Global Alliance's monthly newsletter.
Set professional standards with the global principles of ethical practice in PR and communication management, and be informed with the Global Communications Report.
Join our Global Alliance board or one of our 6 regional councils: Africa, Asia Pacific, Europe, India, Middle East, Latin America, and North America. So now you know. Go global, be global, and join Global Alliance.
Hello, I'm Justin Green, President and CEO of Global Alliance. And I want to wish you a good morning, afternoon, good evening, or even good night, because wherever you are around the world, we have over 500 people joining us this week who are young practitioners and young students. And it's not only a huge occasion for you, but it's a huge occasion for the whole industry, because this is the first time ever such a number of young practitioners and students have come together to engage and to give your views and insights, which are essential for the future of public relations. And the reason that it's so essential is because you are the future for public relations. And today we hand you the torch to continue our profession, to build the standards, to spread our ethical standards around the world. So this is a huge occasion for the profession, as well as everyone participating here today. And I'd like to wish you all the best for this conference. And on that note, I'd like to say thank you to all the countries, to all our associations, to all our members right around the world for making this happen. So from here in Dublin, thank you, have a great week, and I hope to see you soon. Take care.
Good evening, good afternoon, good morning to the young PR and communication practitioners from all over the world. Today is the first day of the Impact, the Global Youth Public Relations Communications Convention. This is the first ever online international convention that will gather current and future PR and communication practitioners to collaborate and team from the industry's thought leaders. I'm joining you from United Arab Emirates. My name is Serra Görpe. I'm an academic at University of Sharjah College of Communication, and I will be your moderator for today's session. Now, without any further ado, it is an honor and pleasure to introduce you to today's speaker, Jennifer Muir. She is the Principal Advisor, Communication and Engagement at the Commission. She has played a leading role in strengthening Australia's use of evidence-based promotion of mental health through strategic communication on behalf of many mental health organizations in Australia. And she's a strong advocate for the inclusion of lived experience voices in a safe and impactful manner. Here now to discuss how effective communication and information dissemination can help countries across the globe address relevant mental issues in her talk, putting the spotlight on mental health, driving conversations through PR and communication. Ladies and gentlemen, dear students, Jennifer Muir with us.
Hello everyone from Sydney, Australia, and thank you to the Global Alliance for the opportunity to speak to you on this really important conference, the Impact Conference. My name is Jenny Muir. I'm the Principal Advisor for Engagement and Communication for the National Mental Health Commission in Australia. I'm also a member of the Global Alliance Council in the Asia Pacific. So I'd like to start with an acknowledgement of country. Why do we do this in Australia? Because our Aboriginal and Torres Strait Islander people are the traditional custodians of the land and all of the components of Australia. So as I'm speaking to you from Sydney, I'd like to acknowledge the Gadigal people of the Eora Nation. I pay my respects to their clans, to their elders, past, present and emerging. I thank them for their ongoing contribution to our community, including their incredible and vibrant communities and their contribution to all aspects of Australian life. I'd also like to acknowledge the individuals and families who have a lived and living experience of mental ill health, suicide and self-harm. They are the people who we represent. They provide us with our inspiration, their expertise and their knowledge, and we thank them. So I want to today sort of break up our presentation, but give you a little bit of an introduction of where I come from. And then we're going to do this presentation in sections so that you can get a taste of effective communication as we've travelled in Australia over the past couple of decades around mental health. So the role of the National Mental Health Commission is to be the leading government agency for mental health, suicide prevention and wellbeing in Australia. We gather research and evidence on ways to improve Australia's mental health and suicide prevention systems. We provide strategic policy advice based on that information to government and to experts, and we act as a catalyst for change. Effective engagement and communication is central to all aspects of what we do, why we do it, and how we undertake our work. So this is a perfect connecting point for all of us today. The Commission works with governments across all levels in Australia and internationally around mental health wellbeing, and we also connect with all of our non-government organisations and our community organisations across the country, and we do a lot of work out in community. Over the past 2 years in particular, the Commission has played a significant engagement and communication role for suicide and mental health and prevention overall, leading the national response to the known impact of the pandemic on our mental health and wellbeing. This has also included a response to a significant amount of natural disasters that Australia has experienced. So we've been very, very busy over the past 2 years, but it has been a really good way for us to expand and build on our knowledge. Now, today's topic is incredibly important. They've asked us to consider how effective communication and information dissemination can help countries like yourselves and us across the whole of the world address relevant mental health issues. Now, I know we all come at this topic from different perspectives and different understandings. So today I'm going to try and give you examples where diverse examples so that you can all have a connecting point. Mental health communication practices and strategies have developed considerably in Australia over the past decade and a half, but have had a long tradition of a couple of decades. Communication, public relations, and media professionals have been instrumental in this role, in raising awareness, in destigmatisation, in lowering discrimination against people who are experiencing mental ill health, suicide ideation, self-harm. It has been a whole of country effort and commitment. That's what I'm going to talk to you about today as a first section. About 15 years ago, Australia had started a concerted effort around the ideas for us around effective communication around mental health and suicide ideation and suicide. The points I make today, I hope, are transferable for you, and the case studies and examples will help illustrate that. I will share with you all of the ways that you can access these case studies, and this whole presentation will be available to you for future resource and access. So if you are unable to write down all the notes, don't worry about it. So in Australia, this journey that we've been on has been led, as I said, by communications professionals, professionals. Research has been key to establish effective and develop effective communication to create and increase effective mental health awareness. As I said, the evidence has been key, and it's not just in the mental health research and evidence. It has also been a necessary new area of research in communications and media so that we can actually measure whether what we are doing is having an effect and it is changing the practices of our own professions and in the media as well. This has been a really deliberate approach and has been largely led in Australia by a program called Mindframe that we are really, really proud of. And I'm going to let you know a lot more about this because it lays the foundations for what we're all talking about today. Another prominent aspect of Australia's 15-year journey has been a real change to the way that we study communication, public relations and journalism in our universities. The Mindframe program has a component to it which has actually influenced those curriculums and the way that we learn about mental health and suicide and self-harm. It's been a very effective tool, as has been professional development and training, because that's been also grounded in early practitioners for PR and communication and in newsroom and in journalism across the board. And I'll let you know more about that. Always understanding the importance of lived experience voices is a big part of this development and also our training. To understand discrimination and stigma and the importance of always doing no harm to those that are vulnerable or those that we care for. The driving motivation is to support, raise awareness, create an environment for inclusion and acceptance of mental health equally as our physical health. So that is the fundamental sort of motivation, and you'll see that sort of examples of that through today's presentation. So as we've gone on this 15-year journey, we've recognised the power of people who have experienced mental ill health telling their own stories as a powerful communication tool. We've also recognised the importance of developing and embedding programs, behavioural learnings, research and thinking. Behavioural insights are a core component of the way that we develop our communication programs and to make them as effective as possible. Great examples of this are the Are You OK campaign and the Boys Do Cry campaign, which I'll also touch on today. So over the past 2 years, it has been vital to have effective communication programs to address the serious mental health impacts of the pandemic. We will profile 2 examples of these for different audiences, and we'll unpack the sort of lessons and the data and the evidence, as well as the outcomes as we have them now from those campaigns. So I'll be getting to all of that soon, but first let's talk about the Mindframe program, because as I said, it sets the foundations. It is a world-leading tool, and it has been developed by our dear friends at Every Mind in Australia. So let's go to the foundational piece, which will be the first kind of case study that we look at for today's presentation. So the journey began with a very, very simple goal. We needed to build the foundations for good mental health communication practice. Our early work with media professionals and journalism educators led to the creation of the Mindframe program in Australia, which has been funded by the Australian government since 2002. Mindframe is our national program that supports safe and non-discriminatory and destigmatising media reporting, portrayal and communication about suicide, mental ill health, and alcohol and other drugs in key settings that connect to all of our communities. The program is managed by our friends at Every Mind, a national institute dedicated to the profession and prevention, of mental ill health and suicide that has become known internationally for advising on effective communications about these issues. The Mindframe program uses evidence and stakeholder input to develop practical, evidence-informed guidelines and resources for everybody to use in their day-to-day work. It works closely with newsrooms, with media outlets, with producers of stage and screen and television and film. It also works closely with PR and communications professionals, freelancers, and media practitioners. It is really influential in helping all of those professions build up their skills and their knowledge and their deep understanding about how to create and develop communication pieces for whatever audience and to disseminate that information about mental health, self-harm, suicide and well-being in a safe and an effective way. That also includes the use of pictures and video and social media and all aspects of the channels that we communicate in, including as we are getting to sort of learn, all of the new social media and messaging app platforms as well. So it evolves quickly, but it is grounded in the evidence. The program also facilitates professional development, which is key to help people apply the guidelines and provides real-time support and advice to journalists and professional communicators as they need it, particularly when there's an issue breaking and there is a lot of communication activity in the public. Early on in the development of the Mindframe program, the team recognised that it was important to embed information and approach in the university curriculums for undergraduate and graduate communication, PR and journalism courses in Australia. So for about 15 years, PR, journalism and communication students have learnt the Mindframe guidelines through practical practice within their courses, and they've had access to the Mindframe team, as well as they are connected to mental health and suicide prevention organisations across Australia to enhance their knowledge as they learn. In Australia also, the Public Relations Institute of Australia, which is our peak body for PR and communication, has been a founding industry member of the Mindframe team. So having that those advisory groups and resources has been fundamental to the way that the Mindframe program has been developed, because it had to be connected to the daily realities of our professional practice and also to be guided by that. It was really important to have those champions also out in the industry. So the Mindframe program has been cited by the WHO, the World Health Organization, as best practice, with partnerships developed between professional communicators and content experts all across the world. A baseline and follow-up media monitoring study has been done a couple of times in its lifetime, and it has showed that the introduction of Mindframe has changed the way that the media have reported on suicide and mental illness to the benefit of our communities. It is now more aligned to best practice advice, and it is considered to be the normal practice in Australia. Since the early development of the Mindframe guidelines, they've been regularly updated because they needed to be as we've changed. So there's been formal reviews and commissioned sort of research around the guidelines so that we're making sure that they are in step with the evolving nature of both the subject matter of mental health and suicide and the growing appreciation in the community, but also with new practices in communication, in media, and as I said, all of those social media platforms. There's still a really, really strong demand and use of the Mindframe guidelines every day, even over the past 2 years. 20 years on, is still contemporary and current and world leading. Even just last year, even through the pandemic, the Mindframe website receives about 4,000 unique visitors per month. So in 2021, despite needing to pivot to COVID, like we all have had to do, the Mindframe team still delivered 89 training sessions to mental health media and comms professionals and media newsrooms, even, by the dreaded Zoom. So Mindframe program has been a core pillar in what Australia has achieved as a world leader in communicating about mental health, but it does not stand alone. It needs constant sort of attention and also a real commitment by professionals even if they're early in their career, to be really present and committed to having a safe practice around the way that they communicate, because that safety and the intentional way in which you do your work actually feeds into the effectiveness of your communication. So at least 30 countries have developed guidelines for media professionals reporting on suicide, with the International Association of Suicide Prevention also developing international guidelines that can be used. Some of your countries also have guidelines or resources on reporting for mental illness and mental health. So try and seek those out as a reference for yourselves. Essentially, Mindframe sets the foundations and it acts as a North Star for the way you approach effective communication. And we've got a video that Mindframe's provided to us today, so we'll go to that and then I'll come back to you after the video.
I think the most important thing you need to remember is that what you write is going to impact on people. You're writing either stories about particular cases of people that have either experienced trauma or have lost their lives, and their families and their friends are going to read everything that you write about the person that they love. So remember that your story does have an impact. And also remember that you just need to use common sense. If you're writing about something and it just doesn't feel right, or if you feel like you should be doing things more sensitively, you probably should get someone to read over what you're writing, seek advice, and have a conversation about it, because there is a lot of wrong that you could do here. You need to seek as much advice and be as well educated as you can be on the topic before you delve in.
Okay, we're back from watching those videos. So there was two videos that we saw. One was a summary of what Mindframe is and how it functions. And the other one was a video that's used in training for journalists in newsrooms to help them understand the do's and don'ts of how to report on a suicide death in our community. And that's really the crux of the Mindframe guidelines, is doing that really safe and respectful reporting, so that we can advance and raise awareness of those issues and really destigmatise them as well. So moving on to section 2. I'd like to talk to you about the importance and the impact of lived experience storytelling. And that is people with a lived experience or a living experience of mental ill health, self-harm or suicide attempt, telling their stories as a core component of effective communication about mental health. So over the past 15 years, we've recognised the power of people telling their stories as a part of effective communication. There's been an increased prominence in Australia and in some other countries like Canada and the UK, and also New Zealand, of lived experience, first-person storytelling to connect our audiences with the personal experience and the personal journey of these health issues. Hearing someone tell their story, their personal account, is one of the most powerful ways to tell a story and to have an effective communication. It allows individuals to have a powerful connection to each other as part of a connected society. Even if you don't know them, you still can connect with that story. It's also one of the best ways to improve awareness around mental health and well-being, but there is a very specific way that we have worked and developed to both be effective, but also for it to be safe. This process involves more than just recording an interview and running a story. It is more than that. Beyond creating a platform for somebody for their voice to be heard, it's upon us as communication professionals to ensure that that person and their lived experience and the way that they tell their story feels supported and that they are heard, as well as, and this is the thing that we've learnt over time, is after their story goes into the public environment, their reaction to that is also a time when we need to support them. But I'll get to that in a minute. So the National Mental Health Commission has developed a tool which is based on, our year-on-year experiences, and we update it as we learn more. And this tool guides us in supporting someone to tell their story, and also, but to mostly do that in the safest way possible and to be supported through that process. That approach has been a real recipe for effective communication. Now, this approach, we generally just call it a do no harm guideline. It gives us a step-by-step approach to working closely with someone to tell their story and to do it in a way that, as I've said, safe, but also really meaningful and effective. And we're able to capture and record that person in their most relaxed and supported environment. The step one in these guidelines is to identify and assess somebody for whether it's the right time for them to tell their story. Sometimes it's not, and that's okay too. I'm not going to go through all the steps of our guidelines, but in some cases it involves involving a counsellor to support that person. It also involves showing that person the recording of the story so that they have the time to reflect on it and provide feedback, and it can be adjusted. It is a process, but it is a process that delivers really powerful results, but you've got to make time and plan for it. And you've also got to it's a really human interaction to sit with somebody and work with them to tell their story. So be prepared for the time and the impact that that will have also on yourself. That is also a big core component of our guidelines. Now, after you get through the sort of process of recording and you get to this really powerful piece of storytelling, obviously you've got to ground it in the context of your communication and what you're trying to do. The guidelines often produce quite a lot of sort of video pieces that we use very effectively on social media and in a sort of a long form sort of storytelling video way. We often do those stories in their home setting or in a setting that they are really comfortable with. Of course, over the past 2 years, we've had to adapt and do it via Zoom or whatever other technology platform. But, like we've all adapted, there's an authenticity in that storytelling. And there's also a way that we've adapted the way that we support people. Essentially, the lived experience storytelling brings to the surface and really acts as a prominent anchor to the way that our communications programs are developed. It also influences the way that the words that we write and all of the other creative elements that we use in all of the materials that we develop. So it kind of gets into the DNA of everything that we do. And once you start to go on that journey of really understanding and embracing lived experience storytelling or living experience, that first person storytelling, and you build up your expertise and your skill set, it becomes a really powerful tool. But also you start to see the impact and the powerful positive impact that your communication is having. Now, we've got a couple of examples that we want to show you that are individuals with different life experiences, different lived experiences have shared their stories. You'll probably be able to sort of understand the effort that went into recording those stories, but the effort was really, really worth it. And we used these video pieces over and over again. So I'll cut to these videos and I'll come back to you shortly.
I was in a different workspace for the fires in a rescue centre down the far south coast, Batemans Bay, day and night for over 20 days. And I think a lot of people were incredibly helpful. People were amazing. Just the soul in people came out. And I know a lot of people see it as horrendous, but there's a lot of people would also think an entire community sitting on an oval, eating together, whether you're rich or poor, and minding each other. It's pretty wonderful. So there's a lot of goodness there, a lot of care. And there's a downside too. And part of that downside was obviously the destruction, but it was also the ending. Everything just dissipated because of COVID. And since then, it's about putting those broken pieces back together, I suppose, a lot of people. It's a rebuild. And it's not just a physical rebuild, it's an emotional rebuild. It doesn't hit you until you get home. Not in my case, it didn't. Having an awareness of that is a good thing. Learning that awareness, to know the difference, to know what other people are seeing, and then what am I going to do about it? So having that awareness can take a long time, particularly if you've got an existing illness. In my case, with schizophrenia, you've got to be present. Get yourself in the moment. Get outside. Put your hands through the soil. I like gardening. I like fixing things. I like to recycle things and turn them into other things. Wood's wonderful to work with because you can shape it. You can build something. It's stable. There's different textures. There's different types of wood. Yeah, it grounds me. Making time this summer is doing what matters, whatever makes you tick. Because it's not the amount of time. It's the importance of doing it.
When we're connecting with country, our mind still.
It's on a deep spiritual level that most people wouldn't ever understand.
I was looking at the sea and I was looking at the sky and the trees and the beach and getting a sense of peace out of it.
My name is Rowena Cox. I come from the Waljaru people, which is situated around the Halls Creek area in Western Australia.
Joe Williams, I'm a Wiradjuri Wobbler man, born in Cowra, raised in Wagga. My name's Serra. I'm a Cairns-born person and I'm part of the Cookie Allengy wider rainforest family.
My name's Mark Richards. I'm a Wiradjuri man, and a lot of my family sort of originate from up near the Blue Mountains around the Katoomba area.
So my name is Paula Hume. I'm Flag Marina and Chihuahua, and my country is Tasmania.
I myself have been an advocate of suicide prevention for 9 years, and I think it's very important that we come together to support our community, especially the people who are struggling in life with issues such as mental health problems, domestic violence, alcohol and drug abuse, and traumas that are affecting our people.
Lived experience for First Nations people in Australia is it's clear that it needs to be defined by those two First Nations. It's very different for an Aboriginal experience as there is for Torres Strait Islander experience.
There hasn't been a community that I've been in, the hundreds of communities I've been in working that haven't been impacted by suicide.
We face a unique set of issues that only those people who have gone through that can really understand.
We as Aboriginal and Torres Strait Islander people, we know these issues because we experience them ourselves in our lifetime.
It's really important to have a look at experience and scope when thinking about mental health and wellbeing challenges for Aboriginal and Torres Strait Islander people.
The concept of cultural safety, cultural awareness, and cultural security, they are all different things when it comes to how people are helped, how people relate to each other.
First Nation people, Aboriginal people, Torres Strait Islander people, people who have lived here for thousands and thousands of years. And in over 500 separate nation groups across the country and 2,500 different dialects of language, there was no meaning for the word of suicide.
It's very important to have a voice, not just to recognize our issues, but stand up and come up with solutions on how we can deal with it and overcome these issues in our community.
There's a lot of want to support within community. this real sort of passion and drive to want to know how to actually approach these conversations with their loved ones, you know.
If we've gone for thousands and thousands of years without suicide in our communities, it's now among the highest suicide rates in the world. It tells you that what we did for thousands of years worked. What we're doing now is not working.
First Nations people understand deep listening, and they understand that healing sometimes comes from that deep listening rather than just treatment.
That lived experience is invaluable because when you're talking about people who have been directly impacted, when you've had that pain and that hurt, you really want to see the situation improve and the situation get better.
There are so many reasons why people get in situational distress, such as what we're going through in the world in COVID. In this case, for First Nations people, there's trauma on trauma, and it's important to look at through everything through that lens.
The challenge with a lot of our communities now is that we're struggling to walk between two worlds. And you look at all First Nation people across the country, and we're strong in one world, not the other. Right? So particularly down the East Coast and the southern parts of the country, we're strong in the relatively new world that's been here for 230 years. And in the northern parts of the country, we're strong in the world that's been here for thousands of years and not strong in the new world.
My connection to my people, my culture, and my country has saved me more than I could ever imagine.
The three key elements that are missing in a lot of our communities, because we're struggling to walk between those two worlds, is people, purpose, and place. Connection to people gives us a community. Connection to purpose gives us a hope. And connection to place gives us our identity.
That connection to country plays a really, really big role in our lives. That real pure connection, you know, whether that connection be to the river, the ocean, the rainforest, the desert, the mountains.
So the answer, if we want to call it a future, the answer to going forward is connecting to our past.
It's almost on a deep spiritual level that most people wouldn't ever understand. And if you ask any other Aboriginal and Torres Strait Islander person, and even Indigenous people from around the world, they will tell you the same feeling, that it's this deep spiritual connection with the land, with the people, with the water, that no one could truly understand. It guides everything you do. And when you're away from country for too long, you get sick. You feel that sickness in your whole core.
I think it's a bit of a two-way street as well when we're talking about connection with country, because when we talk about healing country and spending time on country, looking after country, you know, that real idea of that healing country and connecting with country, I think when we have that connection, country also heals us.
I hope that there's better empowerment for our people. I think self-determination is the most important thing for our mob, and I want to see our young people thrive and survive.
I'm working on a community called Palm Island at the moment. On Palm Island, Boogaman people there are from 40 different tribes around Queensland and Australia. And so my hope is the stuff that we're doing there at the moment is useful for my country, my people, wherever they are around Australia as well.
And I think just that importance, having that lived experience, but also having a voice at the table around their lived experience as well. Because again, you know, all this support, all this knowledge is out there. Sometimes it's just a matter of actually providing a platform for these voices to be heard on a larger scale.
If we continue to put band-aids on these wellbeing and mental health solutions, we'll keep losing people at large and record numbers to suicide and substance misuse. And I don't want to see my people not be here in the next 30 years.
My hope for the future, for my family and my children and my community, is to walk beside my family and community, encourage them and empower them to get educated regarding these problem issues, and also get educated on how to deal with them in order to make their lives better.
I need us to ensure that we take action, and the only way we can do that is if we all have equal voices in making that action happen.
I'm very hopeful at the moment because I see community self-determinations for lots of reasons aligning.
There's so much sort of potential and so much strength and so much power within our communities. And sometimes we don't necessarily see the access to actually sort of, I guess, reach that full potential. And what I'd really love to see within communities, within my own family and other families, is people just being able to live to their fullest potential.
If we're going to make real change, we need to ensure that we're strategically looking at that lived experience as a factor to these senior leadership positions.
I hope that more people can come together and unite with us as we make this stand and hope for the best for the future. And we are the best people to help our people.
Power of the storytelling, first person storytelling, it warms my heart. So I hope that that's something that you will consider and be able to have as a takeaway for today's presentation. Now I'm really proud to share with you two campaigns. One has been going for a long time and it's really powerful and effective, and one is actually just launched on last week. So anyway, I'll talk you through them. So Australia has seen a number of incredibly strong mental health and wellbeing campaigns that raise mental health awareness and have provoked a change in attitude and have contributed to changing behaviours around mental health, self-harm and suicide. Two of these today. A campaign which has been running for 10 years. And as I said to you, a brand spanking new campaign, which is called Boys Do Cry. The Boys Do Cry campaign was launched just last week by the creative agency Hallway in partnership with the University of Melbourne, their Centre of Mental Health and Mental Fitness, as well as a foundation called Gotcha for Life. So those partnerships are really, really important for the way in which we collaborate and do these communication programs. The campaign Boys Do Cry shines a light on men's experience of suicide, distress, and society's expectations of men not expressing their feelings and emotions. Its intention is to bring to light the struggles men face in defying masculine stereotypes and to reinforce the importance of social connection. And hasn't that been something that we've really learned through the pandemic? The campaign comes with the message, when the going gets tough, get talking. Now, as you'll see in the video that we'll share with you, the campaign includes a choir of 30 men from diverse backgrounds who are singing the reimagined version of the 1980s globally popular anthemic song, Boys Don't Cry, by the rock band The Cure. The creators of the campaign were given permission by the band to actually reimagine this song. The campaign, of course, as I said, only just launched. So it will be tracked and assessed for impact and outcomes, as measurement and evaluation is fundamental to us learning the effectiveness of our communications programs. So let's take a look at what they put together.
Sometimes when we're hurting and the darkness comes and fills our mind, we feel like we're all alone without the strength we need to find. Don't like to talk about it, bottle it all up inside. We man up like our fathers taught us, hiding the tears in our eyes. But boys do cry. Your strength is not in silence, sharing what is in your heart. Something to be proud of when what's there is tearing you apart. It feels good to talk about it, to free yourself up from the lies of the voice that said that men shouldn't have tears in their eyes. 'Cause boys do cry. Boys do cry. It's time for us to stand together and show our sons a different way. Turn the tide of darkness that is taking countless lives away. Let's make tomorrow the day that we start. Speaking our feelings, sharing what's hurting our heart.
I've been guilty of a fake smile, yeah, I'm feeling fine. Life of the party, but inside I don't feel alive. Telling all of my closest that it's all good, I'ma be alright. To let them know I'm a broken soul, that honestly is my kryptonite. But my ego, he evil, manipulate me with lies. Like real men are unbreakable, real men don't cry. But real men get help, and real men do cry. I wish I had that combo with my brothers in the sky. R.I.P.
We can do most anything when together we stand side by side. Making a change for the better, not hiding the tears in our eyes. 'Cause boys do cry. Boys do cry. Boys do cry. Boys do.
Wow, I don't know about you, but every time I watch that, I get hairs stand up on my arms. It's really powerful, and we're really looking forward to seeing how it hits the mark out in our communities. Now I want to talk to you a little bit about the Are You OK campaign. It is a not-for-profit mental health and wellbeing organisation of the same name. They've produced a number of incredibly meaningful and impactful campaigns since their inception in 2009. Their inception also comes from very powerfully from a lived experience of suicide. That is what was the motivation of the starting of the whole organisation and of the campaign. So it's a really powerful example of how those two things come together. Are You OK encourages people to stay connected and to have conversations that can help others through difficult times in their life, particularly when they're not feeling mentally well. The conversations begin with a very powerful and simple question: are you okay? The work of Are You OK focuses on prevention and early intervention, and particularly on building the motivation, confidence, and skills of the person who wants to help another person, and helps them have a meaningful conversation with someone who is struggling. Many of the mental health and wellbeing campaigns produced by Are You OK are centred around encouraging people to invest more time in their personal relationships with family, friends, and colleagues. it is at its core, it is around those social and personal connections as a powerful tool. And we know from a psychological evidence that when people strengthen their social and interpersonal connections, it builds up a strength within them, and it is good for their mental health. It encourages people to be alert to those around them, to how their friends and colleagues and loved ones are feeling, to have a conversation if they identify signs of distress or are having difficulty in their day-to-day lives. And it helps connect someone to the appropriate professional services, support services that are around them or nationally available. And particularly, it helps to intervene when somebody is in crisis. There's also an Are You OK Day in Australia, which is held annually, and it is on the second Thursday of September every year. So, what's Are You OK Day all about? Let's find out. Again, we've got some great videos and information to share with you, so we'll go to that and we'll come back to you soon.
Are You OK Day grew out of a project that I started around looking to do something that inspired me and that was altruistic, something that could help other people.
Today is the day when we reach out to family and friends with a simple question.
Well, I'm an ambassador for Are You OK Day. I think you are too, aren't you? Yes.
Dad named his idea Are You OK Day. And I can remember the night he came home and told us about it. I didn't think it was going to be as big as it has become. And now look where I am, talking in front of you about Are You OK Day.
My father took his own life in 1995 and it was devastating.
So I've sort of cut off from everybody now. In that time, if I hadn't spoken to anyone, it's only been someone in the shop to, order something, get a paper or some bread or something. And I've decided that tonight's the night that I'll finish my life.
The idea of finding something that would honour that memory but was consistent with the kind of guy he was important. We intentionally chose the strapline of Are You OK Day being a conversation could change a life, because it actually is the one thing that all of us can do to make a real difference. Getting connected, staying connected is the best thing any of us can do, both for ourselves and for anybody who may be at risk. That said, it's not just about those at risk. We want everybody in Australia, right across the spectrum of society, to just reach out to the people in their lives that they care about and essentially let them know that they do care by asking, are you okay?
Gav's never far away. I often think, what would Gav think about this? And I hope that he'd be happy with where we're going.
He'd be very happy. He would be very happy.
Every day we're hearing how people are having conversations that are changing lives. It's no longer a question for a single day. The conversations are happening every day of the year.
Every Australian, every human has that gut feeling when they know that something's not right with their buddy. And I think it's just about engaging them, getting together, having a chat, having a beer, doing what you usually do.
There are so many lonely people, and often people who know them just don't give them a thought.
When was the last time that you asked a mate or a colleague, are you okay? If it's been a while, it might be time you picked up the phone.
Just that conversation, that question changed my life.
Welcome back. Are You OK? Just as a little bit of a note, Are You OK has been shared a lot internationally, as it is a very simple and accessible concept and translates well into other cultures and other languages and other community settings. So I'd really encourage you to visit their website and really sort of get to know that campaign and all of its components and the way that they approach that. Now, moving on to the past 2 years and the experience of the pandemic and the way that Australia approached mental health, suicide, self-harm, and our well-being while COVID-19 sort of was recognised, and the experience over the past 2 years. Right from the outset in Australia, and I can say, I think it's because of all of the awareness and work that we were pulling from for the past sort of 2 decades, we took the decision, and that was right at the highest echelons of government, that the COVID-19 and the consequential sort of decisions around sort of stay at home and physical distancing and all of those measures were going to have an impact on every single person's mental health and well-being. So instead of waiting for that to happen, we went proactively into that. And what the National Mental Health Commission did was we decided to play a collaborative and coordinating role with all of our friends and colleagues across the whole of the mental health and suicide prevention sector in Australia. So that's all governments, all NGOs, all community organisations, and even private providers and professional bodies, because everybody needed to sort of come together in a really unified way. And the Mental Health Commission had the, I guess, remit to do that. And so we decided to play that role, and everyone was quite sort of supportive of that. And the way that we went about that was, it was very quickly decided that we needed one set of messages that were evidence-based, that were not branded so that everybody could use them. They were very simply communicated, but still grounded in evidence, and they were accessible to everybody. So we needed mass saturation across all communication channels consistently, and also in multiple languages and different formats to suit everybody's communication needs. So starting with that as a core principle, we developed 3 consecutive campaigns that built on each other as the pandemic kind of evolved, and we had to respond to the changing nature of the impacts on our community, as well as the mood of the community in general. Obviously, like all of you have experienced, we all worked very fast. So that was one of the other components of the decision making, is we needed to choose an approach that was agile, that could be updated quickly, and also that was coming from a single source of truth from one sort of authority, so that, and it could be changed across all of the materials and resources quickly when it needed to. So the 3 campaigns: In This Together, Getting Through This Together, and Making Time were all in 2020. They were all developed in a period of sort of 10 days, each one of them, which was very, very fast. And I know you've all got experiences of probably doing communications programs that fast as well over the past 2 years particularly. They, as I said, they were based on very practical tips, things that people could do in their home, in their community, by themselves, that would help them support each other and their own self, their mental health, and also to help them build awareness of if they noticed a change in the way that they were behaving or feeling, that it was likely impacting their mental health. And here were some key tips on how they could support themselves in doing that. As I said, they were all developed with mental health professionals' help, so that they were all evidence-based. And that was really important to the way that Australians recognised the importance and the expert nature of the advice that we were giving them. The trust value in it was really super important. So the campaigns encouraged Australians to be kind to each other, stay connected socially to each other, and also to seek professional help when they needed to. And that was a vital component. The 3 campaigns were championed by the Prime Minister and the Health Minister and all of the governments. That was also very important. We needed that authority to be so that people could trust the information. The results were really monumental, and we're really proud of this. The 3 objectives of, total media saturation for all the campaigns. We generated just over 3,000 original stories, but they had a ripple effect across the whole community. The whole campaign was non-paid. There was no advertising involved in it. It was all through owned channels, as well as a lot of help from our media friends and our social media platforms that picked it up because they recognised the authority of the information and the advice. So we reached 10.8 million people in the first phases of the campaign. So that gives you a good indication of how effective the communication was. We also used really simple hashtags, and that were really easy for people to remember and share, and that had a real active meaning in them. So in this together, getting through this together, making time were the 3 hashtags for the 3 different campaigns. Now I'm going to share with you some clips from those campaigns just so you can see what they look like and how they sort of functioned. We'll go to those now, and then I'll come back and tell you about a different one that we did that's just still in the marketplace at the moment.
Dealing with this pandemic isn't easy for anyone. It's important to play your part. Make sure others are okay. Even if they seem they're okay, they may not be. Helping others helps me. It can help you too. But your support can make a difference. Don't wait for others to reach out. Let's reach in.
As a mum of 3, looking after the kids during COVID has been hard, but we can't forget about ourselves. I realise the importance of looking after myself both physically and mentally so that I can care for others, because my family depend on me.
During COVID, many of us are drinking more. We might think it helps us to switch off, to escape all that negative stuff, but it can become one of those negatives. Alcohol is no substitute for real support from family, friends, or a support worker. It's better not to bottle up your feelings.
If you're worried about money, you're not alone. There's free support to assist you through your financial stress. We can discuss options with you and provide help and advice about how to manage your financial situation.
With union work, I had a routine. I knew what I was doing and where I had to be. And with COVID, it's hard, but I find that a little structure in my day helps. So I try to plan activities that don't involve screen time, like cooking.
We know isolation can make things worse for those experiencing controlling or abusive situations at home, but there's no place for domestic violence. There is, however, a safe place for you to stay. We're here to help you today.
We know our fitness motivation may have wavered a little since March, but don't underestimate the value in a little activity to get a spring in your step and clarity in your mind. Keeping active can help switch your mind off.
There is so much uncertainty right now with how we work and do business. As a business owner, there is a lot of financial stress right now on my business and me personally as well. The business needs a lot of focus, and I can't forget myself in the process. So I have found a lot of free support right now to help me during this time.
The uncertainty and disruption COVID-19 is causing to all our lives can take a toll on your mental health and well-being. It's impacting all of us in all different ways. It's particularly hard for those of us who are living through restrictions. Remember, our daily decisions protect our family, our friends, and our community. And you are not alone.
for each and every one of us. If we take care of our mental health, if we reach out and ask for support when we need it, when we reach out to others and give them the support they need, the more we can be mentally healthy, the more easily we will find our way through. Let's get through it together and let's stay safe.
So we're really proud of those campaigns, and if you need any more information or you want to check out other materials, all of that's available on the National Mental Health Commission's website. So feel free to look that up there.
Hello, everyone. Thank you very much, Jennifer, for your insightful and very informative presentation to us. I'm sure the audience, the participants, they have questions to address to you. And now it's a pleasure for me to invite Jennifer. She's joining us live from Australia to answer some of our questions. Hello, Jennifer. Serra from Sharjah, United Arab Emirates.
Hello, everybody from Sydney, Australia.
I want to start by asking, are you okay?
Yes, I am perfectly fine. I hope everybody's okay. I'm sorry there was a little bit of problems with the sound, but I know that we can. You can access the recording later on.
Yes, the video will be posted through the Global Alliance website, and I'm sure we will be receiving the audience's questions from the chat box, and I will share those with you. Usually the moderators, they have all the time, questions to the presenters, but I'm not that type, but still I can't resist. I have a question to ask you before the audience starts asking their questions to you. Jennifer, how did this whole started in Australia? Like the story, how did it start? Did it start from a grassroots, or how did it become an important issue in Australia?
That's a really good question, Sarah. I think it was probably a combination of a couple of things. Definitely a grassroots movement. Also advocates who were very passionate, clinical experts who were working with NGOs, the governments themselves individually in the regions, as well as the Australian government, were always sort of playing a leading role. And then from a communication perspective, I think as we showed in the presentation, the Mindframe program and the team that led the Mindframe program sort of more than 20 years ago, they played a really instrumental part in gathering the evidence that supported the power of communication as a tool for mental health, but also by pulling together the communication media experts as well as academics, pulling us all together in many, many meetings over many, many days across many years to build the evidence and to support each other. And we just built it year on year.
Okay, thank you very much, Jennifer. Now I'm opening the floor for questions from the audience, please. Okay, so Jennifer, here's the first question. How has Australia addressed barriers in some parts of their community to recognize what mental health is? How do you cross the cultural divide?
Yeah, I think that for our audience tonight or today, this morning, wherever you are, it's probably one of the most important questions and also the most difficult one. If you think about your fundamental tactics and strategies for communication, that you must start with the community that is your target audience. You can't, this is a fundamental belief of mine, you have to sit down with the community leaders and start from scratch with them. Get a really good understanding of what they know, what they are concerned about, and then do a lot of consultation with the community and build up your baseline, because you're not going to be able to be effective if you're not understanding where that community is coming from. So if the community is has some difficulty understanding mental health and mental ill health from a cultural perspective, then you need to start with that very simple problem. Don't try and solve the whole thing. You've got to just start with a little simple problem and ground your solution and your program and your response in the cultural practices and the languages and the understanding that the community have. Can't go sort of creating a solution to communicate to them and using language and phrasing and all sorts of things that don't resonate with that community. So that's the first way to approach the barrier. And the second one is don't be afraid to be innovative in the who you use as a champion within the community. So look for champions, be it the religious leaders, maybe they are actually the barrier. So be really careful. It might be the young people, and you might start from that as the approach. But always do your research first, because then you'll find the answers in that research. And look and be brave, because this is a challenging issue, and you've got to be brave in the way that you approach it, but be very considerate about the reluctance or any barrier that the community has.
Mm-hmm. What I heard from you, Jennifer, is first we need to really understand the community, and we need to do things that resonate with the community. And then the second message you are sharing with us is that we need to look for champions or leaders in the community who would help us with the topic, with the issue.
And I think importantly, sometimes the champions and the leaders may not be who are already the leaders of the community. So you need to consider that, but also I would be very respectful of the structures of the community.
Mm-hmm. Okay, we have another question, Jennifer. Thank you for this. The question is as follows: evidence-based and lived experience seems central to your success. What do we need to think about to put in place to ensure that when we create initiatives designed to increase well-being, we do no harm? So what would be your suggestions that we do no harm when we are creating, good initiatives?
So always gather together your evidence. The way that we sort of our general practice is we build an evidence brief. And that takes all of the clinical evidence and also any research that we do in the marketplace. We gather it all together, and then we bring together also experts in an advisory group, and we develop the idea up from that. We also consider within that advisory group people who have lived experience, and this doesn't have to be just in mental health, in all sort of social issues approaches. And really you could, as a practice, you could transfer it outside if you have a really good practice knowledge. But it's gathering together the experts, recognizing the diversity of the expertise, and build up your campaign or your program or whatever your approach is from there. And always be true to that evidence, always go back to it, to that brief that you develop. Just always use it as a checking point when you're developing up initially your messaging, even the name of it, what your call to action is. Always go back to that evidence, because that's where you will keep a really strong spine through what you're doing.
Okay, thank you, Jennifer. While I was listening to you and paying attention, I got a very interesting question, and now I am addressing this question to you, okay? In some cultures, society has an established perception of how men should be. Men are perceived as strong and without emotions. How do you think we can introduce something like the Boys Do Cry campaign to cultures like this?
Yeah,
What
that's
are your
why
insights?
I was really proud to include this brand new campaign to show you, because it does challenge the masculinity and those social norms of masculinity, and I think we think it's very, very important, and a very difficult journey. So to tackle the same problem in a different community or a different country, it's the same starting point, is gather the men together. They're your target audience. Gather them together and talk to them. Run lots of community consultations and conversations with them. Because out of those conversations, you will get your answer. You have to listen very clearly, but you will get your answer. And it might not be, like we did with the song, but it will be completely appropriate for that community. But you've got to listen, write lots of notes, record them, and then develop up what you think will work, and then be brave and take it back to the same men and have them work it up with you so that they're involved in it, because when you involve them, they own it, and then they become very proud of it, and they become your champions.
Okay.
So it's you've got to plan it out step by step.
Excellent. We also have another question, and when I read this question, my mind went back to COVID and how important the employee and internal relations in organizations become. And now this question is asking you, in some countries, mental health in the workplace is overlooked. How can we make organizations look into this better and prioritize it? I mean, to some extent, maybe COVID-19 helped us to look into this issue, but the question is, asking in some countries, mental health in the workplace has not been paid enough attention, and what can we do to prioritize it?
Okay, this is a very, very big question, but very important. And I guess the phrase, if you've heard the phrase, a silver lining of something. So the silver lining of COVID has been the raising the awareness of how important your mental health is, as equally as important as your physical health, in order for you to be really productive and effective, have effective workplaces. There's a couple of approaches that you can have to this, and you can choose one or you can choose all of them. I'll just give you a couple. When in your workplaces, you probably have a whole safety program around, not to put cables on the ground so you don't trip over them, so people don't physically injure themselves. There's usually an awareness of that, so you can make our workplace physically safe for people. There's a equal concept called psychological safety. So that means that the bullying and harassment and any of those practices in the workplace all contribute to a person's mental unwellness, or can do. So it's about building a culture within an organisation that recognises mental wellness or mental well-being. That's one approach. In Australia, we have psychological safety is actually part of our legislation. So employers are required to make workplaces psychologically safe as well as physically safe. So we've got a little bit of an advantage in that. So that's one way. A second way is to, through your HR, human resource practices and those kind of programs, you can build what we call a mentally healthy workplace, like a group, and they can build programs to raise awareness of people's mental health and well-being. Things like having days off that are good for people's mental health and well-being, or so they can care for their mental health and well-being without being penalised. So that's a very big thing to try and get done, but it's it means a lot if people can take a rest and take care of their mental health and well-being. Now, the third one is an economic argument, and it's usually the one that's the most powerful for change behaviour and change management, is if you've got a mentally healthy workforce, you've got the most productive and effective workforce for your business. So if they are not mentally well and they're not being cared for, then you are not going to get the best out of them, and therefore your business and your company is not going to be the best it can be. So there is an economic incentive to actually invest in and support your workforce's mental health. And if you can build that case, that business case, and there's very easy ways of doing that, but you need to kind of start with the foundations and build it up, then that's often a very effective way to convince sort of boards and CEOs and all sorts of other employers to actually pay attention to this.
Thanks, Jennifer, for your strategic approach, how we can, make this mental health a priority in our workplaces. I do have another question. How can public relations and mental health collaborate together?
Oh, they go hand in hand. Look, often when you're working in a space that is around issues that are supporting human beings, so whether they are social services, health, mental health services, the communications and PR specialists are often not provided with sort of big advertising budgets and all of that kind of thing. So we have to be very clever, but also very resourceful about working together with the mental health experts and coming up with really clever solutions. So often I find, and I'm very proud to promote this, is that PR and communication experts and professionals are very good at being very resourceful and developing really effective communications programs with not a lot of budget.
Thank you. Thank you very much, Jennifer. We are done with the questions that we received from the audience. And on behalf of the participants, I would like to thank again Jennifer for answering our questions and for your presentation on how effective communication and information dissemination can help countries address relevant mental issues. And it was a pleasure having you with us today. I also want to thank to the wonderful audience for being a part of our celebration of the Student and Young Practitioners Month. And we hope that you enjoyed the first day of Impact. And please make sure that you attend the next few days of this convention and let us learn from the thought leaders in our field in public relations and communication. As it has been highlighted earlier, the video will be posted through the Global Alliance website. And again, I'm Serra Görpe from United Arab Emirates, Sharjah. Thank you, and all of you, wherever you are, have a wonderful day.
Thank you, everybody. Take care of your mental health. Bye.
Bye, everyone. Thank you.